Welcome back. And back with us today is Dr. Reagan Tilley, functional family physician. We are going to talk about some sensitive topics, so I just want you to be aware as you continue watching. Welcome back, Dr. Tilley.
Hey, it's so good to be here again, Jessica.
So glad that you're here.
Thanks.
So we've talked a lot about trauma, big T trauma, so those are things like car accidents or abuse, and then little t traumas, which can be, give me a little example.
So some of those can be kind of that ongoing, underlying, uncomfortable living situations, just ongoing nitpicking from a parent, things like that.
Okay.
And that can be big trauma for some people, but those are just kind of simmering, smaller traumas that are ongoing.
Okay.
Yeah.
And I know we had talked a little bit about trauma and how it's related to addiction.
Mm-hmm.
I'm assuming that a lot of addiction is to numb you out or to escape from whatever that might be.
Right.
I'd love to hear you speak on that.
Sure. So, I mean, if we would look at what we think of or imagine somebody who's an addict, right? Mm-hmm. That usually gets a really negative connotation. Mm-hmm. There's lots of addictions. There's drug addiction, porn addiction, food addiction. Food addiction is one of those that's really difficult because we all eat. Yeah. And so a lot of people closet eat. They'll hide that addiction. There is also addiction to power. There's addiction to control, things like that. Those are the different types of addictions that people may have related to trying to change how they feel. So much of the time, addiction starts as just an attempt to numb out some pain. We try a little bit of alcohol, or we try some pot when we're younger, or some people will use other, things like marijuana, meth, cocaine, heroin, all of that just to numb out because they want to turn off or feel different. All of those are impacting our neurotransmitters. Things like dopamine and serotonin are highly affected, and then we lose the ability to create the calming and the feel-good neurotransmitters naturally. Our bodies are made to produce those through just experiencing life. Those people who are high on life, right? Mm-hmm. Yeah. Their neurotransmitter systems are excellent. They are 100% on it, right? Mm-hmm. So what I've experienced a lot of is in the jail medicine that I used to do, we had a lot of people that would come in on opiates, and we would do detox. We would have to try to help them come off of that substance. And what we did is we symptom managed. A lot of it was the discomfort. They didn't want to feel pain, and so what they got was this rebound of massive pain, nausea, gut problems, and then their anxiety went through the roof. And so with that, their vital signs became affected as well. And so we had high blood pressure, tachycardia, there were so many different things that they went through physically. So what I want you to do is understand, we're moving into that physical sensation, mm-hmm. right? So think about a time you felt really uncomfortable, or you had been a part of something that created a lot of trauma, right? And how did you feel in your body? So again, I don't want you to go into that space right now of feeling really anxious or like you are going into that trauma again. But think about your heart rate was fast, your breathing was shallow, you wanted to run, that fight or flight, right? You wanted to just kind of, I'm a fighter. I'll deck somebody, right? Mm-hmm. But a lot of people will shut down, or that's called fawning. Other people will run. They'll just go hide. For me, my first reaction is to lash out a little bit. So I don't choose to sit in those areas anymore because I know how to control my emotions, and mm-hmm. I've learned how to accept and absorb and not be, but I let it go through me. With addiction, though, people are trying to find a way to numb that feeling, the pounding heart, the pain, because emotional pain can be physical pain. Right. And so they are looking for a way to fix that. I was listening to Carolyn Meese, who does a lot of work in medical intuition, spiritual healing, and things like that. And it's just a wonderful lesson that day about we're trying to plug a hole, right?
Yeah.
So people who have food addictions, when you're uncomfortable, what do? And then you don't even have to be a food addict to be somebody who wants comfort.
Right.
We think about the things when we were a kid, we went to grandma's house and we got a cookie, it made us feel good. Mm-hmm. Or it was family dinner, and in order to just cope with the family dinner, it was Thanksgiving, so we just ate. Because if we were eating, we couldn't be arguing, or we couldn't be feeling uncomfortable. We were making Aunt Sally happy that we tried her Jell-O salad, right? Yeah. So these are all the things that we stuff with, right? So that's what can lead to a food addiction, which can lead to obesity for some people. Mm-hmm. It can also lead to drug addiction. If we have this more maladaptive coping, even food addiction is not well adapted, but it's an acceptable adaptation. But there's other types of addictions. Like I said, that power, that control.
Yeah, tell us a little
And
bit.
success.
Yeah.
You know, looking at these high achievers, right? The CEOs that seem to have it all, right? They've got all the money, they've got the latest boy toy or girlfriend, all of the things, the big cars, the big house, all of that. That's kind of an extreme achievement level, but a lot of people use that for their kind of vision boarding that they do. They want to have all of that stuff. And they're addicted to the success that it takes to get there. Biochemically, the same neurotransmitters that alcohol, heroin, cocaine can impact in our body, or the rapid scrolling on your phone, right? The flip, nonstop TikTok mindset. We have the 30-second brain span these days.
Yeah.
Those are the same neurotransmitters that success, that power, that achievement can give you as well. So some of our high achievers are not happy.
Yeah.
They should be, because they've got everything, right? You've got the job, you've got the house, you got the dog, you got the kid, you got the car, right?
Yeah.
But inside you still feel like you're missing something. So the next hit is the next success.
Okay.
It's the next level of achievement. And again, I'm not here to assign right and wrong.
Right. Because
I'm
I can
here-
imagine a lot of people are like, so
what's wrong with that?
what's wrong with
Right,
that?
yeah.
I feel great. I've got
Exactly.
all the things.
Yes.
I'm pretty happy. The issue comes when they're not happy.
Right.
Is that it? Or
Yes.
when they can't settle down and say it's not, I can, what happens when they retire?
Right, right.
So maybe it's like I can't get to that next level
Right.
of, and is it personal sense of achievement or is it attaboys from outside of them?
It's both.
Okay.
So that's your love language. That's a whole different topic, but
okay.
it can have to do with your love languages, or how you receive praise, how you receive the understanding of what success is.
Yeah.
So often, what I find when we're working on kind of that trauma care is that we aren't able to accept success or a win or something good on face value, because we don't have that external validation. Because when we were a traumatized child, we needed mom or dad to be happy, right?
Okay.
We needed to receive that in order to know we did right. That was our answer. So it does come from outward success, and so that's why a lot of people get kind of addicted to how many followers do you have? How big is your email list and all of that, and you feel personally attached to those numbers. It's a healthy attachment when you notice it. It's like, oh, that's cool. But when it's like, oh, somebody unfriended me.
Oh, so you're saying people that are in that space, then they're so sensitive to that those little things that we can see might be an issue.
Yes, yeah.
So when we compare this, I mean, my presumption is, because I want to make sure that, say, I know we have a very high achieving audience also, and I don't want anyone to say, well, wait a minute, it doesn't mean that's where you are.
No.
It's whether you're happy or unhappy. That's what I'm going to tell you, and whether you have this need of that. We hear all the time from highly successful people, I wish I had spent more time with family.
Exactly.
On their deathbed, or when they're older, when they are really highly successful. It's like, I wish I had done this in hindsight. Is that basically what you're trying to do? Help people see there is a whole global you that you can experience?
Exactly. And I was going to lean into that. So thank you for kind of bringing that up, because what I want the high achievers to understand is that there's nothing wrong with achievement at all.
Yeah.
There's nothing wrong with success. There's nothing wrong with also understanding when it's not giving you what you need. So when you find yourself constantly getting and growing, and you've made it, you've got everybody telling you, hey, look at this level you've achieved, and inside you're like, I don't feel any better, I don't feel good. That's what I want to work on with you. Because if we can help you find peace, if we can help you find that balance of what is the thing that you're trying to fill this empty hole with, then all of those things, the accolades, the success, and all of that will actually give you fulfillment. And you may not need as much. There comes a point when too much of a good thing can be too much.
Yeah.
So what I have learned, and what I have successfully been able to work with people through, is finding what it is they're missing and helping to enhance that. Some of the things that people have told me after working with me on in this space, on this program, is that my kids like me again. My wife doesn't want to stab me in the eye with a fork when I open my mouth. we like to go for walks together because we actually enjoy spending time together. Or I've learned that nature and I get along really well. Nature's my new church. I go out there and I can just soak it in. I don't feel like I'm wasting half an hour when I go for a walk because I should be doing 15 other things.
Yeah.
I can get those 15 other things done more elegantly when I'm really doing well on the inside. And so this is where I try to meet people at. This is a wonderful headspace to be in because that's where healing occurs.
And they present as, everything's fine, but something's off. Is that basically how they present? Or?
Oftentimes what I see is, it's usually just one little thing. It's like, everything's great. I have a great marriage. I have a great job. Everything's fine. I don't understand what's wrong. I just don't understand
why. Am I not happy?
Yeah. Why am I not happy? Or why can't I feel good? Like they're exhausted. So unhappiness and depression can present in the body in different ways. So it can be insomnia. It can be tummy aches or belly aches. It can be rashes. It can be hair loss. It can be any number of physical symptoms, right? So I say I see and take care of everything.
All of it.
But all of it really comes back to this core issue of whole health, body, mind, and spirit unity. Where are we at when we are truly functioning at our highest level?
Oh, that's wonderful.
Yeah.
Well, thank you for being with us again. Will you please let everyone know how they can find you?
Sure. So my brick and mortar practice is Whole Health MHK, and the website is simple. It's wholehealthmhk.com. I do run an online program, and it is called the Quantum Metabolic Reset. The website for that is very simple as well, quantummetabolicreset.com. You can find me and work with me in person or virtually.
Thank you so much. I will see you back again next week.
I can't wait.
Thank you for joining us, and please stay tuned after these messages for our next guest.